welcome to Medcan Presents, Medcan's webinar series that happens every second Tuesday, every other Tuesday. This is Tuesday, December 1st, and this is Medcan Presents, How to Safely Celebrate the Holidays. I'm here with Medcan's Chief Medical Officer, Dr. Peter Nord. Peter, how are you today?
You're good, Chris. How are you today?
I'm good. Thank you for doing this. I can see the numbers are climbing. I am going to start a poll with this webinar. So just as people come in, so how are you planning on celebrating the holidays? Isolating at home and not planning to see anyone? Video conferencing with friends and family is where it's at. So folks, this is a multiple choice holiday poll, and so we can you can pick more than one on this one. So drinks are fun even at a distance. Outdoor excursions with limited number of friends, such as skating excursions and winter hikes. Outdoor gatherings in garages or backyards. I'm heading away to a winter destination. And then despite guidance, I'm heading somewhere warm. I can see nobody is picking that. That's good to see. Despite guidance, I'm planning to gather indoors with limited groups of family or friends. So I will just give people another minute or two to answer that. And let's start with the preamble for the webinar, which is Medcan's Medical Advisory Services team works with some of Canada's largest companies to ensure their worksites and employees are safe. Now, that same team applies their knowledge to help Canadians enjoy the holiday season safely and responsibly while COVID-19 case numbers are high. Indoor socializing is banned in some jurisdictions. How safe is outdoor socializing? What's best guidance on whether to see older relatives? Should we forget about indoor get-togethers at all and opt for backyard or park socializing? Medcan Chief Medical Officer, Dr. Peter Nord, provides guidance. Let's end the poll and share the results. So we have 38% of people are isolating at home and not planning to see anyone. 64% are video conferencing with friends and family. That's great. 30% are using outdoor excursions, such as skating excursions and winter hikes. 19% outdoor gatherings in garages or backyards. 2% are heading away to a winter destination. And then nobody, that's great, nobody's going somewhere warm. And then 26%, I'm planning to gather indoors with limited groups of family or friends. So I will stop sharing that and we will talk about the actual guidance. Peter, I'm going to start by sharing our webinar deck, which provides some of the guidance from the province, which was great to get to. Sorry, folks, I'm just going to share this screen. Okay. And let's start the slideshow. So a couple of days as we were leading into this webinar, Doug Ford gave a press conference and he said, I know there are many people looking forward to their traditional family celebrations at this time of year, but to keep your loved ones safe, traditions will have to be adjusted. We're asking everyone to please stick to your own household when celebrating. Avoid big holiday parties or large family dinners to help us stop the spread of this deadly virus. By following this public health advice, we can all have a safe and fun holiday season. So the official guidance from Ontario public health officials is no matter where you live in the province, the safest way to spend the holidays this year is by only celebrating in person with the people you live with and celebrating virtually with everyone else. If you live alone, consider exclusively celebrating with one additional household as a safe way to spend the holidays. Dr. Peter Nord, can you walk us through this next little bit in terms of the logic behind some of the province's suggestions on safer holiday activities versus riskier holiday activities?
Yeah, sure, Chris. It's just some really good examples of what are things that we would normally do during the holidays that maybe we have to rethink a little bit. So a little bit of this in terms of risk management is thinking ahead. Really planning ahead and not just, and that's the way we're going to have like a great holiday, even with the restrictions that are in place and to do it safely. And again, although these are sort of, we'll go through a few of the slides, they're sort of binary. There's, again, it's safer and riskier. And I think one of the themes that we have to get out is risk is on a spectrum, and there are very risky activities, and there's some activities that are zero risk. And depending where we live in Ontario and in Canada, and where we choose to put our risk tolerance is going to define where we are. That's within the bounds of the regulations that are different from region to region. So obviously we need to be complying with the public health recommendations, and in fact, it's very strict guidelines for all of our different regions. And then within that risk parameter that's been set by the public health officials, what can we do to really reduce that risk even further to where we feel comfortable, regardless of what the regulations are saying? We all need to be comfortable. We have to be comfortable recognizing that there is risk no matter what we do. And, one of the really frustrating things about all of this is we don't know if we got this right until it's too late, right? So we slipped a little bit. Maybe we got together with a few too many people. We got a little too close, that we weren't wearing our masks as much as we thought we should, but everything's fine. Everyone goes home and is great. And then 3 days later, 2 people are sick, and one of them ends up in the hospital, and then everybody feels bad. And then you go backwards and go, maybe we should have been a little bit more careful. Nobody wants to be in that situation. So it behooves everybody to be really strict up front, because all of these individuals that are ending up in hospital that are not doing well at all, each of those has a whole raft of people that are attached to that person that are going, like, feeling terrible because they know that by some means they passed the virus along that person and now they're in hospital. So that's the challenge. So we can go through a few of the slides. You can go through them, Chris, but that's sort of the framework of where these slides came from, and just some real interesting thoughts about, what things are a little safer and which things are riskier.
So Dr. Nord, thanks for going through the logic behind it. So outdoor holiday activities such as building a snowman or going on a sleigh ride with members of your household, safer holiday activities, and then riskier indoor holiday activities such as having overnight guests or sleepovers with friends or people outside your household. I mean, this is pretty logical. Mm-hmm. Safer holiday activities, visiting Santa Claus, Mrs. Claus, or their elves outdoors and taking photos while keeping 2 meters apart. Visiting Santa Claus indoors or Mrs. Claus without being 2 meters apart. Okay, pretty basic stuff. Safer holiday activities, attending a drive-in or drive-through event. Riskier holiday activities, visiting family or friends for non-essential reasons. I mean, the province is really, doing their best to discourage these indoor gatherings. Safer holiday activities, watching holidays or other movies with your own household, decorating outdoors, putting up lights, baking holiday treats, and then riskier holiday activities, hosting or attending social gatherings or organized public events that do not adhere to the requirements. So, I mean, I think that's it, yeah. So let's move in. So now, if you are, Dr. Nord, if you are in an area where indoor gatherings are allowed, or if you're considering, in a best case scenario where if numbers go down and things change, is there guidance? Are there, rules or suggestions that we can have that would make indoor gathering perhaps with like one single other family, or perhaps your mom or dad does live alone and you're going to be gathering with them? What are some steps that you can take to make that indoor gathering permissible, or at least to cut the risk of that?
Yeah, so permissible would mean really being aware of what the regs are in your particular area, because they are different from region to region. I pick on Timmins. Timmins has no COVID cases. So risk is much lower than in some of our air quotes hotspots that are around the province right now. So I think the first thing is being aware of the prevalence of COVID in your community. And most of us are getting that just from our local news, online. We get a sense of what's going on in our community. That's probably the most important thing, because then you have a sort of a heightened awareness. People, geography to geography, and then even over time, have changed their behavior according to the risk within the community. So that's probably the first most important thing. So understand where the guidance is coming out of public health. The color schemes that we're in right now, they're there for a reason. They're not done haphazardly. Whether it's provincial government or local public health units, they're making these decisions based on data, and they're balancing the risks of what the regs bring to bear, and the risks of not doing that. Obviously, we're looking as well at the stats from our healthcare system, as you don't hear it as much in wave 2, but wave 1 was all about flattening the curve. And that meant really at any time, we have to be watching what's happening in our healthcare system. Across Ontario, we're looking at the ICU rates right now. They're right around the threshold, which is 150, give or take a couple of points. And that's an important number for us to watch. And so all of these inputs create the recommendations. So permissible means underneath the recommendations. After that, it's what you feel comfortable with. So there's a personal risk tolerance where some people are a little more cavalier and some people are very, very conservative. And that's based on your own personal background, your history, your past medical history, those people that you're connecting with as well. They're all data inputs essentially that create a recommendation. And so within that, we know how we can reduce the risk down to that one side of the spectrum. And it goes back to those basic themes again. It's wearing a mask, it's 2 meters apart, frequent hand hygiene, not touching your face. All of those things are the things that are, again, not sexy, but they're going to work in the long run. Those are the things that are going to get us there. Vaccines are coming. That's going to be a big help. But right now, going into the holidays, those are the things that are going to help us manage our personal risk. And that's what goes into some of these examples of what things we can do. Outdoors is less risky than indoors. If you're indoors, fewer people is less risky than more people. If social gathering with somebody who maybe has a health condition, wearing a mask inside other than when you're eating, and then masks go back on. Some of it's the reality of this you have to think about, and you realize that during the course of an evening even, people might be great when they arrive, everyone's distanced, let's say we're wearing masks, and then we're eating and we're maybe having an alcoholic beverage. And after the second beverage, there's a little more close hugging, and maybe we weren't hugging when we got there, and now we are hugging, and all of a sudden, a lot of the social distancing is not so distant anymore, and we go home, and then we find out that we've actually spread the virus to 3 or 4 other people at the get-together. So, and nobody wants that. It's, again, every person that's got a positive case has a bunch of people that are feeling terrible about it because it didn't come out of the blue. They got it from somebody else. So that's just to paint this picture. And so within the framework of the community regulations for the communities that we live in, there is this personal choice. And again, for the most part, unless you're having a wild Airbnb party like we heard recently, the enforcement officers aren't coming knocking at your doors. This is entirely up to everybody to self-manage and really police yourself when it comes to these things. And then you make some personal choices. And those choices have to be, again, within the framework of the regulations for the community, and then bringing that risk even underneath those regulations to a level that works for you personally, and hopefully means that 3 to 4 days later after the get together, no one feels bad.
I love the way that you describe the personal risk spectrum, because it is and to me, one of the issues is almost empowering yourself to take precautions if you are going to, have, if the situation does get to a point where it's possible to have people within their homes. One thing you and I discussed a little bit was the notion of opening windows to increase airflow. Does that cut risk? Is that something, that people should consider?
Yeah, it absolutely does. And that's why for most of the regulations, there's sort of an outdoor gathering and then an indoor gathering, and they're very different. The recommendations around outdoor versus indoor are very different. So outdoor, the obviously fresh air movement moves droplets so that they're not contacting other people. Again, the whole point is to prevent virus from leaving my respiratory tract and entering somebody else's respiratory tract. So we're wearing masks on both sides, we're distancing. But outdoors, it just reduces the risk even further because of the dispersion of the drops is very, very quick. And so as it disperses quickly, the chance that a droplet is going to be going from one person to the next drops significantly. Indoors, if there's no air movement at all, the droplets are going to be certainly within that 2-meter range. Again, gravity will affect the droplets and bringing them down, as opposed to having them float in the air. Obviously, if we're shouting or screaming or singing, which can happen over the holidays, you might get a bit of aerosolization as well. So you get these little microparticles that have virus attached that'll be suspended in the air for more time than the heavy droplets. And that's where some risk is. And so if you're outdoors, even if you're laughing, shouting, cheering, singing, the dispersion is great so that your risk goes way, way, way down. So outdoor caroling, all a good thing. Indoor caroling, if you can open the windows, get the air circulation, even fans, if you have fans that help move just the air circulating, anything we can do to condos are often designed so that they have a natural airflow to them. And so anything we can do to ensure that all of that airflow is moving appropriately, that's all good. That's all risk reduction.
Thanks for that. What about other ways to, I think about things that people in my circle of friends have been talking about. And so one of those mechanisms is, banning eating, not serving food at all at anything to reduce transmission. So let's talk about that. And then let's talk about drinking, because I think you have some thoughts about that as well.
Yeah, so the transmission of the virus with food handling has actually been shown to be very, very rare. And that's something we've learned over the last 6 to 9 months. At first, we were very, very concerned about that. Turns out that eating is not real. Even if there was somebody sort of coughed on something and there was droplets there and you ate it, the acid in your system actually very quickly kills the virus. So that risk of using food as a vector of transmission is actually quite low, never zero, but it's quite low risk. Again, if you want to take away that risk completely, it's no food, no drinking, masks on all the time. And so really the risk of eating is not that the food is a vector. It's really that our masks are off, we're eating, and now are we going to be close, engaging with each other? It's very easy if your mask is off to forget that it's off while we're eating and drinking. So we have to be reminded that if we're not, then the mask goes back on. So that's the real risk, is we're close, we're sharing food together, and our masks are off because we're eating. And again, like I hinted before, drinking, same thing with the drinking, but again, with alcohol, typically human nature, we start to really enjoy ourselves, we get a little disinhibited, we forget about the mask, we're getting a little closer to one another. And that's been sort of a fact that's actually been proven. And that's why some of the regulations that we were in sort of in a code red, code orange, is closing bars and restaurants after 9 p.m. or not allowing them to serve alcohol after 8 or 9 p.m. because they found that up until that point, the restaurant, the servers, all the guests that were at the restaurant were actually pretty good. Like they were able to maintain, following all the regulations. When alcohol came into play and people are a little more tired, now they're disinhibited, they're a little more free with their behavior. That's when things would fall down, and that's when a lot of transmission would happen. So one of those early recommendations for dine in was no alcohol after a certain amount of time, because we found for sure alcohol ends up causing issues downstream. It's just a little less likely that people are going to be following all the regs if they've had a drink or two.
They actually, it's almost, so food is okay, and almost consider banning the drink. That's the, or at least limiting the consumption.
Yeah.
Let's switch over to questions from webinar attendees, because we have some that were submitted in advance, and then we have some coming in now. And as usual, folks, webinar attendees, you can ask questions through the Q&A function on the Zoom platform. You can also use the chat function. Let's talk. Okay, so the first question, I am 79 years old and in good health. I have decided to fly to my home in Florida. What type of mask should I wear? I have been wearing medical masks that I buy at the drugstore. I'll throw that to you.
Yeah. So those medical masks are probably the best that you can get. And as I've said, I think on previous webinars, there may be cloth masks that are fine, but we just don't know. What we do know is those surgical/medical type masks will definitely stop 95% of all the droplets from leaving that mask, from you leaving. And will do a very good job on the prevention side as well, even though they weren't designed to prevent the wearer from getting infected. It's about preventing the wearer from spreading droplets. And again, think about in the operating room, the surgeon wearing the mask. Surgeon wears that mask to prevent infecting the person they're operating on. And so that's how we have to think about the mask. Those are the best masks. They're mostly because they're predictable. They've been studied. They've been manufactured in a way that's highly predictable. When you start to get away from that, it may be fine. It may not be. It's just hard for us to comment on anything other than those medical/surgical type masks. Obviously, 3-ply, 2-ply plus filter. Those are all excellent. They would be compatible with the medical/surgical mask, but that's the mask to wear for sure.
Next question. I have a friend who has converted their 10 by 18 garage, 10 by 18 feet garage to an outdoor patio. They've told me the seating is 6 feet apart and masks are not needed if we stay distant, and we can bring our own booze, bring our BYOB. They also said they will have the garage door open at all times to allow for ventilation. Is this enough to mitigate the risk of getting COVID? Am I safe to go there?
Yeah, so there's a few variables there. It's hard to say for sure, because how much, with the garage door open, that's great. It's closed on every side except for one. So you're kind of in a box with only one side of the box open, as opposed to being in the back patio where there are no walls. So you're still in a box, but it's possible. It's good. It's better than being in an indoor environment for sure. Probably not as good as being in a totally outdoor patio. So I get that. So there's a little bit of risk there. And then when we start to think about 2 meters, 6 foot separation, and you think 180 square feet, each person needs 36 square feet, you're really having a maximum of maybe 5 people if it's laid out appropriately. And then back to the BYOB, it's if it's booze that we're bringing for the B and not our best friend, then it's you have to watch out because again, we're back to that same descriptor of alcohol is going to create problems at some point for sure. It does increase your risk. So it's better, most likely better than an indoor unventilated space. Probably not as good as a true outdoor space. And then again, even if they said appropriately spaced, but that really means you probably have 5 people or less set up in that environment.
So I'm going to shift to one of the questions that has been asked, which I think it pertains to a lot of people. I'm certainly wondering something similar. So how many days in advance of a COVID test should I quarantine to ensure an accurate result? And then to ensure, okay, so I want to see my mom for Christmas. So if I go for a test on Friday, December 18th, what should be my last day of work and groceries? I can work from home for 2 or 3 days in advance of heading for a test. Thank you. So just more broadly than the specific details of this one, the question is, what should be the sort of flow from test, quarantine, and visit aged parent? Because I think a lot of us are wondering that.
Yeah, no, it's a great question. And the answer goes back to our understanding of, and again, we'll talk averages, and then there's obviously a spectrum, a bell curve around the average. So we'll keep that as the disclaimer. But on average, if somebody is infected on, let's say, day 0, day 1, it's growing in the person. If you had a test on that day, it wouldn't be most likely a positive test, even though the virus is in your system. Day 2, most people start to have the test become positive, no symptoms on average. Now, day 3, symptoms start, again, on average. Some people that may take longer, but on average, about day 3, symptoms. Maximal infectivity around that piece. The infectivity increases asymptomatically, peaks at about the time that we start to have symptoms. And then our symptoms essentially are our body killing the virus. So almost as soon as you have symptoms, the viral load starts to decrease over time. So when we talk about testing, and assuming we're talking the nasal swab PCR testing that we've been using up until now, that's going to become positive probably about day 2. So day 0, day 1, day 2, on average, that nasal swab will become positive. And again, they may have no symptoms at that point at all. Right now in Ontario, the recommendations are that if you don't have any symptoms, you may not be provided a test at an assessment center, right? An assessment center is where you go to be assessed. Many people, if they go to an assessment center during that period right now where you're asymptomatic, you're not having any symptoms, will actually not be provided a test. So now we're talking about, I have symptoms, that's typically we're talking on average about day 3. That test then has to take a certain amount of time to get processed. That might be a day or 2. It was 4 days. We're getting better. We're down to almost 24 to 48 hours at this point. So in terms of getting an answer to know that either you're negative or positive, but obviously we want to make sure you're negative, you'd have to allow for the time of the test processing. So that's at least 2 to 3 days. And then in terms of on average, you'd want to be 3 days to 4 days before that to make sure that that's an accurate test, that it's actually picking up the virus. And again, it's a bit moot in some regions where they're not testing people asymptomatically. So you're only getting a test when you have symptoms to confirm, is that COVID or is it influenza or is it something else? And so that's really why we're doing the testing on that specific day. So hopefully that helps a little bit. And again, that's an average. Some people may take a little longer to develop symptoms. We know that. We used to think really that 14 days, we're finding out that that's really not the case, that people will have symptoms for the most part within a few days. And a couple of people very rarely will have symptoms that'll be delayed 7 to 10 days. But that's another one of our learnings over the last 8 months or so. So that's sort of when we want to get the test.
So correct me if I'm wrong, but what you're saying is there really isn't a mechanism, particularly in Ontario, where you're not supposed to get tested if you're asymptomatic, to ensure that you are safe when visiting an aged relative necessarily, like aside from those who are in long-term care homes, because I think you're allowed to then, but because you get the test, you have to wait 48 hours, and by that point the symptoms have probably shown up anyway. So the idea with the prophylactic testing is, well, if I don't have the symptoms, I I may be asymptomatic and infectious, but you won't know until you're infectious or until you're receiving the symptoms anyway.
Right. So in the absence of a test, we go to the timing, and then if you have the ability to, if your high risk situation is working, then you want to probably be a week before you see your loved one, at least a week without symptoms. Because after a week, if you've been theoretically exposed or in a high risk situation, if you haven't had symptoms at all by 7 days after that, then there's a pretty good chance that you're fine. And again, reduce your risk, mask, distancing, see mom, but everyone's wearing masks and distancing, and a 7-day clear period without any symptoms.
To game this a little bit, and I know MDs typically hate questions like this, but if most people are exhibiting symptoms 3 days in, can I really cut my risk if I quarantine myself? Basically this is me wanting to go see my folks. So if I quarantine myself for 3 days before that and really are disciplined about it and see nobody and really have no contact with anybody, and then go see them, if I don't have any symptoms, then I'm pretty good, it sounds like.
Yeah, that would be the minimum. And again, up to, if we're talking about a large, sort of on a population basis, you'd maybe want to stay 7 days, a clear period.
Okay.
But because so 3 days would be the average, right? And then unfortunately, none of us are exactly average. So you want to maybe give an extra buffer, and then, again, all the same preventative strategies that we want to have, especially if our aged parent has any chronic conditions that would put them at risk. Obviously, the risk is higher there, so we want to have risk mitigation strategies that match that level of risk.
Okay. So lots of questions, and we're past time. So do you want to shift into? Want to try to shift into short answer mode?
Sure.
I am a designated caregiver for my parents who are in a retirement home and a long-term care home. Visits are important to their well-being as well as necessary. How do these visits fit in to the risk spectrum?
Well, they're high risk, but the nice thing about the environment is it's a controlled environment, and everybody knows that the risk is significant. So again, just back to that last answer, if our risk is high, our mitigation barriers, our mitigation strategies need to be equally high. And the good thing about long-term care homes, retirement homes, is everyone recognizes the risk that a virus going into that environment can kill people. And so very stringent risks up front that reduce our risk significantly. So it's actually not a bad thing, because as opposed to an uncontrolled environment, that's a highly controlled environment. So approach it that way.
Okay. Please make suggestions for people who eat in groups with their hands in a central platter without utensils. Yeah, okay, that's actually interesting. What do you think?
Yeah, again, hand hygiene is critically important. So starting before that would happen, everyone should either have washed their hands appropriately, hand sanitizing. I'll put a plug in underneath the nails. The virus mostly lives underneath our nails. So if we just do this and we think we've cleaned our hands, that's probably not good enough. So we have to really get in proper hand hygiene, get under the nails, whether that's with alcohol-based hand sanitizer or soap and water. So do that right. So your hands are clean. We're not coughing on our hands. So let's assume somebody is infected around the table, but not coughing. So hands I'm picking up food, which is not infected. I'm putting that in my own mouth. That's not infected. So we're actually not sharing individual pieces of food with each other. We're just taking a morsel and eating. So the risk is actually quite low. The only risk there is not the food per se. It's about being really close to one another and obviously not wearing masks. So that's the real risk. It's not so much the food, it's the proximity to the food. We're literally at an arm's length from each other. And if there was any, and we're not wearing masks because we're eating. So that's more the risk. than the food. The one way to mitigate that is hand hygiene.
Fantastic. Quick question. Do children under age 10 pass the virus? I think that's a hard question.
I mean, yes, anybody can pass the virus. One of the silver linings to COVID is that it's sparing our young people and our pregnant mothers. So that's great, as opposed to influenza. So little known fact, influenza A and B kills children every year in Canada. We have a mortality that's associated with that in an under 15 age group, where we're just not seeing that level of impact with COVID. So small silver lining. And so kids can pass. They tend not to become sick. If they do get sick, they have relatively minor symptoms. Again, on average, some people we've had deaths in young children, so it's not absolute, but certainly can pass the virus. And the risk then is they not passing between each other. In fact, we've been looking for that. We haven't seen student-to-student transmission, and we haven't seen student-to-teacher transmission. What we're seeing is when there's an outbreak in a school, it's mostly a reflection of the prevalence of the virus in the community. And it's just, so it's not really a petri dish for growing bacteria. It's mostly or a virus. It's the virus that is just being transmitted from the community member to the child, back out to the community and into a household. And the risk there is bringing it back to a household, parent, or even worse, grandparent who might be in the house, gets sick from that. So absolutely, anybody can transmit the virus.
I thought that there was increasing evidence that the virus is spread via aerosol droplets, which increases the emphasis on physical distancing. This is the question. Why is there still such a push on hand hygiene if that is no longer a significant transmission vector?
Yeah, so words like significant, there has been a lot of media around the aerosolization. By far, the droplet spread is by far how this virus is spread. So even though there's been some headlines around aerosolization, that's old news. We've known that from China in Wuhan, and that hasn't changed, that there are situations where the virus, as I mentioned earlier, can be aerosolized. No question about it. But by far, the most common way that this virus is spreading through the community is by droplets.
Fantastic. Should we still be wiping down our groceries?
No.
Good. Provincial guidelines for Toronto and Peel permit outdoor gatherings for fewer than 10 people. Are outdoor cocktails safe? We've sort of dealt with that already. I'm going to keep going. As a Medcan client, I am able to get a COVID test. Will I be able to get the vaccine in a timely way? I mean, why don't you speak to that? Because, I'm sure you're getting a lot of questions about that.
Yeah, so at Medcan, we are offering the COVID test. It's limited, our ability to do that is limited on a day-by-day basis, but it is possible to have that asymptomatic test. It's totally permissible because the publicly funded system is only ordering or you're paying for the test if you have symptoms. So asymptomatic, fair game. And so in terms of the vaccine, it's a little bit unknown right now. What we are likely going to see is the governments, federal, provincial, local, will obtain the vaccines as they become available, make them available to first responders, to frontline workers in healthcare, long-term care, home workers, and residents as a first go. And I would suspect it's going to be quite some time before corporations or an organization, even a healthcare organization like Medcan, is going to be able to be provided vaccine for its clients. We might be able to be provided it for our staff that are working as frontline healthcare workers. But in terms of making that available to our clients, that may be a ways away.
Great. Okay. Thank you for that. I'm a recently resolved COVID case who is now in good health without symptoms. Can I safely see family one-on-one without any risk of me infecting them, or vice versa? Those are two questions. Okay.
Yeah, it's a great question. The assumption is, and glad you're feeling better. That's amazing. And so the good news is doing well. Second good news, we assume that there is an immune response that your body generated to kill that virus, and that's going to persist. Now, we don't know how long that's going to persist for. And actually, we're doing some research work at Medcan to try and determine that. But if we assume even a couple of months of immunity, then you are going to be protected against that particular strain of COVID. Silver lining for COVID is mutating very slowly. If it was mutating very quickly, a vaccine that's designed for the strain from 6 months ago, by the time it gets manufactured, doesn't do much good. So thankfully, the COVID virus is mutating, but mutating very slowly. So we have had some people that have been reinfected. Looks like it was a very slightly different strain that our body hadn't recognized before. So that's always a possibility. But with that proviso, your immune system is charged up and ready to fight any of the same strain of virus. So that's great. The second part of that is it in your system still, and can you pass it on? Typically, once you've had no symptoms for at least 72 hours, you can be quite sure that you're not infectious at that period. So at that point, good to go. One of the lucky few. If you're definitely COVID-19 positive and have gotten better and you're 72 hours without any symptoms, you're most likely good to go.
That's fantastic. I mean, that's nice to hear. And that pertains to a couple of questions. My granddaughter is day 14 after onset of COVID. Can she join us for Christmas dinner? We would say yes, relative to what you just said. And how many days in advance of a COVID test should I quarantine to ensure an accurate result? Okay, that's a little different of a nuance than we've discussed. So maybe you want to take that.
Yeah, it really is. Again, on average, you really would only need to, it takes 3 days from the time of inoculation to the point of the test becoming positive, 2 days to 3 days. But again, it's moot because we're not getting those tests until you have symptoms, and symptoms are 3 days to 7 days.
And if my kids and I fully isolate ourselves for 14 days before Christmas, are we safe to visit my parents for Christmas Day in their home? You said 7 days. Are we safe? I don't know. So that's a bit of a different nuance too. So because we were talking about the 7 days in relation to testing. If my kids and I fully isolate ourselves for 14 days before Christmas, are we safe to visit my parents for Christmas Day in their home?
Yes.
So yes is the answer. Great. Okay.
Yeah, 14 days, no symptoms. Everyone's feeling great. Totally isolated, like basically quarantine. You can be very sure that none of you have the virus at that point.
Fantastic. Well, that's great. That's it for our questions. That's it for the webinar. I am going to share my screen again to talk about future webinars, which the next one, we are coming up on the new year, December 15, Tuesday, 12:30 p.m. Stopping evening snacking, morning meditation, rigorous exercise every afternoon. As 2020 winds down and we look forward to a brighter and better year, many of us are thinking about ways to improve our wellness practices. Hence, tips for New Year lifestyle change. Behavioral change is a much researched topic, and the scientific evidence suggests there's a right and a wrong way to go about it. So in this webinar, Medcan Director of Weight Management, Dr. David Macklin, walks through the science of lifestyle improvement to assist those looking to make changes with the new year and beyond. Register at bit.ly capital M, so /M Medcan _new year, and find past webinars. So this webinar will be archived on a webinar, Medcan's YouTube channel at youtube.com/MedcanLiveWell. That'll be at some point tomorrow. Finally, the last podcast that we did is how to think about COVID's finish line, and that's taking the psychology. It's actually, this is a fascinating podcast episode. It's taking the psychology of ultra running and applying it to the thinking about how to get through this last phase of COVID. And it's Alex Hutchinson he's a physics PhD. He's fascinating. He also runs an almost 4-minute mile. So pretty interesting guy. Dr. Peter Nord, thank you so much. This has been fantastic as usual. And I think we're a little premature, but I'm going to say happy holidays to you.
Yeah, yeah. To you and all our viewers, it's been a great few months of trying to answer everyone's questions. So we'll have lots more as we get into closer to the holidays, and then afterwards we'll have lots of stories to tell after the holidays. So it's been great. Stay safe, and as I said, be patient.
Stay safe, everyone, and happy holidays. Okay, thanks very much.